Meeting of the Okeechobee City Council. Today's date is July the 7th, 2020. The time is 6 p.m. I'd like to welcome those that may be joining our meeting via Zoom. And I will just remind those that are on Zoom, if you would like to make a comment on any of our issues, just either use the raise your hand or the put your comment in chat, or put in that you would like to make a comment on chat, and the host here at City Hall will let us know that you would like to make a comment. Our invocation this evening will be by Pastor Glenn Hanna of First United Methodist Church. Our pledge will be led by Councilmember Gerald. If you're able, please stand.
Let us pray. Lord, I thank you for Okeechobee. Lord, pray your blessings upon our community, and tonight upon our leaders. Bless those who join us from their homes. Be with each one in our community. See us through this crisis, Lord, that we might be stronger on the other side. For these things I pray in Christ's name. Amen.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Mayor Walker?
Here.
Councilmember Abbott?
Here.
Councilmember Clark? Here. Councilmember Darrell?
Here.
Councilmember Key?
Here.
Attorney Camaro?
Here.
Administrator Montague?
Here.
Police Chief Peterson?
Here.
Fire Chief Smith?
Here.
Public Works Director Allen?
Here.
Deputy Clerk Paulus? Here. Executive Assistant Robin Rock? Here. Finance Director Reed? Here.
Thank you very much. We'll ask first, are there requests for the addition, removal, withdrawal of items on the agenda?
Mr. Mayor?
Yes.
I'd like to take item C off for discussion on the consent agenda.
Okay, when we get to the approval of the consent agenda, we will take off item C. Okay. Any other additions or withdrawals? Hearing none, do we have a motion to adopt the agenda? I have a motion by Councilmember Gerald. Do we have a second? Second. Second by Councilmember Keith. Any discussion? All those in favor signify by saying aye. Aye. Opposed? Motion carries. Next, do we have any public participation cards turned in? Anybody from the public? Anybody on Zoom for public comment?
No, sir.
Hearing and seeing none, we'll move on. Next is our proclamations and presentations. I'll come down front for the first presentation. This is a very special one. Marvin Roberts for 20 years of service to the city. And we'll let the Public Works Director go first.
You're in trouble, Ron. I got notes.
Oh.
No, we're recognizing Marvin for 20 years. That's a long time here at Public Works. We figure he's only got 24 more years to go to beat Cleveland's record. And he assures me, no, I don't blame him. I think that record will stand for a long time. Marvin is an indispensable part of our operation. When I first came here almost 8 years ago, one of the first things I recognized is we had this gap. I had Marvin, and well, really it was Marvin that identified there. I had maintenance operators and I had a foreman. There was no place in between to recognize the people that have been here with a lot of years of experience, that knew this operation well, and were really a cut above just the rank and file maintenance operator. So we created a position of lead operator, and Marvin was the first person that we worked that position. Definitely something to recognize him for. He's got certifications in maintenance and traffic, excuse me, temporary traffic control. For those of your engineers that know that the FDOT decided to change things. Traffic signals, and he's kind of a right-hand guy for knowing what we can do as far as spraying on these, and both on the aquatic and the other pests. So he's got those. Of course, when Donnie retired, what, 2 years ago, Marvin had been here and with recognition of his experience, we promoted him to maintenance foreman. So he right now really is my right-hand man. I asked the guys today a couple things, so there's something they wanted me to say, and Marvin, you're gonna be getting a chef. The guys expect some lunch out of that, otherwise they told me a couple good nicknames that I might want to reveal, so is that a deal? That's a deal. You know, in Public Works, we've got a good strong team, and that one of the things is, well, we're always out there working in not the brightest conditions, and so we always try to keep a little bit of a sense of humor. And again, Marvin really plays into that. And again, knowing in the community, I don't think there's ever been a day I've been out with Marvin and been doing some project out somewhere where 3 or 4 times people don't honk and, hey, Marvin. Of course, he's the voice of the Brahmins. He's probably coached or done something youth-wise with just about every kid in this town. So he's definitely an asset to the community, and people know him well and appreciate him. So, Marvin, thank you for all that you do.
And Marvin, we have a longevity service certificate presented to Marvin Roberts in recognition of 20 years of service, hard work, and dedication to the city, its citizens, and your fellow employees from July 7th, 2000 through July 7th, 2020, presented the 7th day of July, 2020. The mayor and the council, we thank you very much for your work, and we appreciate all that you do, not only for the city, but for the community and the youth of our community. So congratulations, and here's that other thing he was talking about. So congratulations. You want a picture? Okay, we want a picture here. Step up what? In front of the podium. Excuse me.
Okay.
Now,
All of your eyes.
You have the floor. You may address the council.
I just want to say, years ago, we had a guy working for us named Brian Paget, and I asked him to write a speech for me. I've been using him for, thanks for having me.
Thank you, Marvin, and I think this just shows, we've always said, we talk about the city family, and to have someone with us for 20 years is quite an accomplishment. And I will say, when I'm driving around and I see the guys working, and I know we give sometimes we give our public employees a hard time, but, I'm in my truck with the air conditioner on high, and I ride by and they're out there with shovels, and, of course, the sweat's just pouring, and so we appreciate all that you do and that, your fellow employees do. So congratulations, Marvin, and thank you very much.
All right, thank you.
Great speech. Okay, the next proclamation we have, I will read into the record. It's to call the November the 3rd city general election. Proclamation, Office of the Mayor, notice of 2020 general city elections. Whereas under and by virtue of the provisions of the Charter, Elections Chapter 26 of the Code of Ordinances for the City of Okeechobee and Florida state laws, it is the duty of the mayor to proclaim and call general city elections at the time and manner provided therein. And whereas proclaiming general city elections shall be issued by a proclamation at least 90 days prior to the date of holding such election, signed by the mayor and attested by the city clerk. And whereas such proclamation shall specify the office or offices to be filled, the cause of the vacancy of such offices or offices, and the date of the expiration of terms of such office or offices. And whereas the city clerk shall publish the proclamation in the local newspaper at least twice, once being in the 5th week and once in the 3rd week prior to the week in which the general city election will be held. Now therefore, I, Dowling R. Walker, Jr., Mayor of the City of Okeechobee, Florida, do hereby proclaim and declare that a general city election is to be held by the duly qualified electors of the City of Okeechobee, Florida, for the purpose of electing the following offices to serve as such for 4 years, beginning January 4th, 2021, and ending January 6th, 2025. Following such election or until their successors are elected and qualified, 2 city council members. Said election shall be held on November the 3rd, 2020, during the regular hours of voting, to wit, from 7 a.m. to 7 p.m., to be held in the county polling or voting places within municipal precincts which have been established by the supervisor of elections and board of county commissioners for Okeechobee County, and during the early voting period as provided by state law, to be held from October 19th through 31st, 2020, or vote by mail as provided by state law. In testimony and witness of the foregoing notice of general elections, I have hereunto set my hand as mayor of the city of Okeechobee, Florida, cause the corporate seal of the said city to be affixed and attested to by the city clerk the 7th day of July, 2020. Okay, that ends our presentations, and we'll go to the consent agenda. We've asked to have item C removed, in the other item removed from the consent agenda. Hearing none, do we have a motion to approve the consent agenda items A and B?
So moved.
We have a motion by Councilmember Clark. We have a second. Second by Councilmember Key. Any discussion? All those in favor signify by saying aye.
Aye.
Opposed? Motion carried. That leaves item C on the consent agenda for discussion. Councilmember Clark.
Yes, I just have a question because it is for the GPS equipment. And my question was, number one, is that there are, I'm trying to pull it up on my agenda. 7, I was asking a question, they're requesting 7 GPSs.
Yes,
So what pieces of equipment are we putting that on, that we need 7?
they will mimic the same protocols as what the county's doing. We have not seen the MOU from the county, although I know they're working on it with this preemption kit. So this is just going to match exactly the same protocols. I know primary, secondary units, ladder truck. I know both chiefs, this chief as well as the county fire chief, are going to have it. And then I think the additional service responding vehicle.
So for the city, we have 7.
7 vehicles that would follow the same protocols as the county to respond to
So you're saying it'll be like all the engines, the ladder truck, all the engines,
the brush and the 2 responding trucks.
and the chief's truck and the captain's truck.
Yes, sir.
In lieu of the discussions that we're having about the fire department, is this a little premature in making this decision? If we do take the fire department to the county, they would only be taking 2 pieces of equipment, and we would,
3, I think 3 pieces.
okay, well, a truck, right, pickup
Oh,
truck.
yeah, that's right, I'm sorry, yes.
So my question is, why would we be doing this now?
And I know the fire discussion, we'll get to that later, but this is something that probably on the trucks very soon. The MOU will probably get from the county, I'm assuming, within the next month. So this would go into operation across the city. For the most part, I think even extend it out on other lights throughout the county. So I would say we want to provide the same service until that point that the county provides. And preemption is basically, I don't know if you guys noticed, but we have a switch. We hit a switch now and the lights will turn, both the signal here as well as the main light. This is the new service and DOTs, and we actually already had set up with DOT on the new light coming in as well. This is preemption that it knows where the fire truck is and will clear the light for the truck. And again, this is for city and county. Again, there's a forthcoming MOU. I spoke with Chief Franklin on this. Actually at our workshop, he said it was forthcoming to us. So again, it's providing the same protocols that did for our citizens up until this point. And again, the county's going to utilize that system as well. So, and that MOU would continue on even after that, because Public Works is, like here with Marvin, they're still going to be responsible for a lot of the equipment in the city for the lights.
Yes, I think the question is though, if we were to contract with the county to provide this service, and let's say they take 2 of our pieces of equipment that have this on it, do we need to, at this particular time, should we go ahead and get you see what I'm saying? I understand what Councilor Clark is asking,
I'll say this.
we wouldn't need it then.
Correct, but again, that's it. Even though our discussions now, we're still over 8 and 9 months away.
So we're talking about something that would serve our citizens here within the next hopefully month. So, I mean, you have that time.
And is it worth doing that for 8 or 9 months? Or should we wait just a month or two to see how this, that's my thought. I mean, I understand what Councilman Clark's asking, I think.
The only,
I think also, you know, why would we, is it really important for us to put this on the brush truck?
Well-
I'm not questioning the fire department and their decisions on which piece of equipment it goes on, but I thought, I mean, how often are we gonna be using the brush truck and changing lights? So, I don't know, how often do we use our brush truck? I thought we
any response, but you can
We
respond.
don't use it as a brush truck, it's basically, it's a hybrid of brush truck and it's a medical apparatus as well. We do run it, we do have some rescue tools on it. We run it towards the medical calls as well as vehicle accidents, so we use it mostly for that. But obviously, we don't have a whole lot of brush truck, brush fire. We use that opposed to using an engine, $400,000 engine, we just take a $100,000 brush truck. So that's when we use it.
So we need to put this on the seven vehicles.
Totally up to you,
I know, but 7 vehicles, right?
if you want to do one, you should do all.
And again, this is just to provide the same service the county's already working on, to provide all their trucks up until this transfer goes over. Again, item was budgeted, within the previous year's budget for, again, there'll be another item forthcoming as soon as the county finishes their MOU.
Mayor,
Yeah, Councilmember Happy, yes.
when is the county going online with this?
As soon as the MOU, like I said, I've spoken to them, we have a memorandum of understanding to work on, because this apparatus will be installed on our lights that we are charged to maintain. So we have an agreement with the county that something were to happen to this equipment on the lights, that they're going to come back and, repair it or be able to work with them on paying for the fix. So that is
So when do
forthcoming.
we think that MOU, I think that's the question.
My understanding is within the next month, because that's what I was told by Chief Franklin. So we should have that quickly,
So this could go into operation
within a month.
within a month, okay. I think that was the question. Councilmember Keith, yes.
Just to suggest, add a suggestion, maybe would it be prudent to, in light of Councilwoman Clark's suggestions, maybe to just approve whatever ones, the amount that will be on vehicles that would potentially go to the county versus all 7. I mean, just a suggestion, a thought that crossed my mind in light of that discussion. I mean, I understand, as Chief said, if you do one, you should do them all type thing. I mean, I understand that we are still responsible for providing services always, whether it's in-house or contracted. So if we have the vehicles and they need the equipment, I understand that as well. But just a suggestion along those comments.
I believe those can be moved around as well, we can take one out,
Yeah,
and
they
move
could.
it and take it to another.
Thank you.
Okay, well, we need to make a decision one way or another what we want to do here. So the recommendation from staff is to approve the purchase of 7 kits. Do we have a motion?
I'll make a motion that we approve 7 kits.
Have a motion, is there a second? Motion by Councilmember Clark, the second was Councilmember Gerald. Councilmember Gerald. Any discussion, any more discussion? All those in favor signify by saying aye. Aye. Opposed, motion carried. Thank you very much for the discussion, appreciate that. We'll open the, we have a comment from the public.
Well, I have a comment requesting everyone to speak louder.
Okay,
It's sounding very muffled.
okay,
So if everyone can just consciously speak louder than normal, that'd be great.
okay. I apologize, I'm wearing a mask for a reason. I don't think I'm positive, but number one, I'm concerned with the level of increase that we've shown, and I didn't feel well over the weekend. I didn't go to church, and I didn't go to several other events because I just didn't feel well, and I didn't want to spread something. So you know, I guess we're all scared to death, so that's why I'm wearing a mask. So I'm trying to speak as loud as I can through a mask. And I hope you can hear me, and we will try to do our best. Thank you. Thank you, Robin. We'll open the meeting for our public hearings. The first, we need to read by, we need a motion to read by title only, proposed ordinance number 1211, allowing package sales of alcohol beverages on Sunday, which is Exhibit 3 in your packet. Do we have a motion to read by title only?
I'll make a motion.
Have a motion by Councilmember Clark. Is there a second?
Second.
Second by Councilmember Keith. Read by title only. Discussion. All those in favor signify by saying aye.
Aye.
Opposed? Motion carried. Mr. Attorney, would you read ordinance number 1211?
An ordinance of the City of Okeechobee, Florida, amending section 6-1 of chapter 6 of the Code of Ordinances, providing for the sale of alcohol, including package sales within the city at certain times every day, providing for conflict, severability, and an effective date.
Okay, do we have a motion to adopt proposed ordinance number 1211?
I'll make a motion.
Have a motion by Councilmember Clark. Is there a second?
Second.
Motion, a second by Councilmember Abney. We'll open it up for discussion. First, I will ask, no, we don't need to on this one. Do we have any comments from the public? Anybody from the public to comment on ordinance number 1211, allowing package sales on Sunday? Hearing none, we'll bring it up here for discussion from the council. This is, of course, the second reading, and this is to adopt it. Comments from the council. Any comments? One comment I'll make, as I voted against the first reading, I intend to vote against this reading. I understand the theory, but I have two issues. Number one, we've always tried to stay, particularly with package sales of alcohol, in line with the county, and I think this will put us out of step with the county regulations. And number two, just from my personal beliefs, and I think we should, as a country, there are certain things that we should respect, and I think one of those would be having alcohol sales on Sunday morning. I think we could wait till 1 p.m. or something, but that's just my opinion. So, no other discussion. We will vote on the motion. All in favor of ordinance number 1211, signify by saying aye.
Aye.
Opposed? No. Okay, motion carries. So. Ordinance number 1211 is adopted. The next, we need a motion to read by title only, proposed ordinance number 1213 regarding rezoning petition number 20-001-R for 2.87 plus or minus acres located along Southwest 7th Avenue from residential multifamily to industrial, submitted by, is that Lumax Development, Inc., Exhibit 4 in your packet. Do we have a motion to read by title only? Motion by Councilmember Gerald. Is there a second?
Second.
Second by Councilmember Clark to read by title only. Any discussion? All those in favor signify by saying aye. Aye. Opposed? Motion carried. Mr. Attorney, would you please read ordinance number 1213?
Yes, sir. An ordinance of the City of Okeechobee amending the official zoning map of the city by rezoning certain tracts of land more particularly described herein from residential multifamily to industrial zoning district. Petition 20-001-R, amending the zoning map, providing for conflict, severability, and an effective date.
Thank you very much. Next, we need a motion to adopt proposed ordinance number 1213.
I'll make a motion.
Have a motion from Councilmember Clark. Is there a second?
Second.
Second by Councilmember Keith to adopt ordinance number 1213. The first thing before we ask for staff or public comment, I would ask that the council, is this the appropriate time, Mr. Attorney?
Yes, sir.
I would ask the council to, this is something new for us, council, but it's something that the clerk and the attorney said that we need to do. We need to disclose any ex parte communication we have had regarding this rezoning. And as I understand it, that's any conversations you've had, either pro or con, with the developer or the petitioner or any members of the public. I understand it also includes if you've been driven by the property to inspect it, or if you've had any, I'll let the attorney say if there's other things that may be involved.
Yes, sir. So the reason you do, this is a quasi judicial item, any kind of zoning or rezoning, it's about a specific tract. You do two things here. You do quasi legislative, which you just did previously, was a quasi legislative action. So if the local package store owner had called you about it, you wouldn't have to disclose it. Zoning, rezoning is quasi judicial. So any interactions, any emails, or if you made an independent effort to look at the property, walk on the property, that should be disclosed at this point in time.
Does anybody have any ex parte communication they need to disclose?
Yes.
Councilmember Clark?
Yes.
Did
Will you
you-
say yes?
Yeah.
I had a discussion with Mr. Fowler.
Yes,
I had a
Councilmember.
discussion with the agent, Mr. Dobbs.
Councilmember Gerald.
Conversation, Steve Dobbs.
Okay.
I've spoken to Mr. Dobbs and drove by the property, looked on the property appraisal website, looking at doing my due diligence. Also happened to speak to the property owner as well on site and yeah, sounds good.
Thank you. I as well, I did drive by the property and I did speak with Mr. Dobbs, so inadvertently, but we did speak on this issue, so that should do for ex parte. I don't think we have a staff report here. We had that at our first hearing. I'll open it up for public comment. Any public comment on ordinance number 1213 on the rezoning? Seeing no public comment, we'll bring it up here for discussion from the council. I know we had some discussion on this. I'll just make the same comment I made at the last meeting. I feel like we have a obligation to the surrounding property owners, and I just don't feel like this is the appropriate spot for industrial. So, yes, Councilmember Clark.
I have had two discussions with many board members.
Okay.
I'm sorry, with Mr. Chartier and also with Ms. Hoover.
Thank you. Any other discussion? We'll vote. Oh,
Mr. Mayor,
Yes.
if I may, I don't recall if I commented previously at the first reading. I had asked when the owner was present, I had asked about his moving expenses and all that. I just wanted to make a comment, we are in, we have a small town, a couple square miles. There's not a lot of room to grow. We do have an industrial park, and I think that one of our jobs here as a city council is to grow and culture the community as, it should maybe be, what am I trying to say, in an appropriate manner. This is why we have these zoning, we vote on whether or not things get changed. I think that where we feel zone parcels are inappropriate in their current locations, I would like to suggest in the future, possibly looking at helping those type sites that maybe should be in an industrial park, moving them to our industrial park. I don't know legally how that would operate, but however it would work out real estate wise, we've got property, you've got property, subsidizing a move, whatever be in the best interest of the city and the potential future growth of that property and the potential future growth of the business, to do business in the in our industrial park. We've got a beautiful park that has some vacancy, and we've got some prime real estate in the city that I could name a few that I'd rather see in the industrial park, that don't need to be there, but that's just where they've been for 30 plus years. So I just wanted to make that thought and suggestion. Maybe we could look at that in the future as an option. If it is an option, I'd love to see that work out, because we could design our small downtown to be, more pleasant versus our more commercial, light commercial stuff on the main corridors versus industrial type stuff that we could relocate.
Thank you very much. Any other discussion? Yes, Councilmember Joe.
I'm against spot zoning, but in this situation, here's a gentleman that went into an area that was industrial when he went in 20 years ago. He's a good businessman for our community. He's got 35 employees. He's had an issue with trucks on the highway, and this is gonna solve that. So, being against spot zoning, but I think this is a special exception.
Thank you. Any other discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, no. The motion carried, so the rezoning is approved. Next, we need a motion to read by title only for both proposed ordinance number 1214 regarding rezoning petition number 20-002-R for 0.5 plus or minus acres located at 204 East South Park Street from residential multifamily to central business district, submitted by Best Value Real Estate LLC. It's Exhibit 5. Do we have a motion to read by title only? Motion by Councilmember Gerald. We have a second. Second by Councilmember Keith. Any discussion? All those in favor signify by saying aye. Aye. Opposed, motion carried. Mr. Attorney, would you read ordinance number 1214?
Yes, sir. Ordinance City of Okeechobee amending the official zoning map of the city by rezoning a certain tract of land, or particularly described therein, from residential multifamily the Central Business District, petition number 20-002-R, amending the zoning map, providing for conflict, severability, and an effective date.
Thank you very much. Before we ask for public comment, again, we'll ask if there are any ex parte communications regarding this rezoning. Hearing none, we'll move on. We had our staff report at the first reading. Do we have any public comment on ordinance number 1214 rezoning?
Mayor,
Yes.
I apologize. We need a motion to adopt.
Oh, yes, we do. Yes, we do. Thank you. We need a motion to adopt proposed ordinance number 1214. Sorry. Motion by Councilmember Clark. Second by Councilmember Gerald. Thank you, Madam Clerk. I need somebody to keep me in line. Any discussion from the council? I think we discussed this quite a bit at our first reading. No discussion. We'll vote on the motion. All those in favor signify by saying aye. Aye. Opposed, motion carried. It is resolved. We'll go down to new business. The first item under new business is an update from the Florida Department of Health of Okeechobee County regarding COVID-19. Tiffany Collins, and I apologize to Tiffany. At our last meeting, she was here. We had a lengthy discussion.
Somebody retired?
And,
They get to do that around here?
yeah, so I apologize at the last meeting. We went way long. So thank you for being here. And look forward to it.
So as we all know, we're still in phase, can you hear me okay? Okay. So as we know, we're still in phase 2 of our plan to recover under the Governor's Executive Order 2139. As of July 1st, our funding structure in the Department of Health has changed. We've received $139 million at the state level in CARES dollars to fund our ongoing operations. We're moving from a disaster phase to a more recovery phase. We're moving more back to blue skies for our regular operations and moving into using these CARE dollars to fund contracted positions. And we've gotten 1 LPN and so far 4, a couple of them just showed up today, contact tracers to help us get our school health nurses, which has mostly been helping us, as well as some of our epidemiologists, back to more blue skies operations. I've asked the community to look for volunteers to help us with our call center. We've had on the higher end of 50 more calls a day. They still are coming in. If I don't get any kind of consistent schedule from the community as well as volunteers, so I'm going to have to shut down our call center. We have had lots of questions. Of course, we will still answer the testing, the scheduling, but it was more just questions about COVID and what do I do and how do I keep my operations going, just general questions about COVID and kind of things that we've been taking the time to work through that, I just really like to keep up and going for our community. but operations we will still obviously continue to do. DOH is going to continue to focus on our high risk, and we're going to prioritize based on our ability to respond. Contact tracing, investigations, we're going to continue to focus on those that are hospitalized. Healthcare workers, first responders, those that are in a long-term care facility working or residents, those that live in a congregate setting, correctionals, DJJ facilities, homeless shelters, those that are over the age of 65 with symptoms, those with severe disease with symptoms, and then pregnant women with symptoms. DOH has pushed out self-investigation tool. You may have seen it. We really want people to know that if you have COVID, you really need to be self-isolating at home for a period of probably about 14 days, and that we really want you to be reaching out to your contacts and letting them know that they do need to be self-isolating at home. If you're healthy, you will be asked to stay at home, making sure that we realize that the majority of individuals, especially in Okeechobee County, that are testing positive, we have a median age of 35, that about 80% of us will be able to recover at home. So this is a tool we're pushing out to make sure that you know that you should be self-isolating at home. If you are capable of doing so, please don't go to work or school if you're sick. So we have pushed out that tool to fill in the gaps for any of the contact tracing investigations that are not focused at the high priority populations. I talked about the call center. So if you're interested in helping the health department with the call center, keeping that up and going, we will need to know by this week. If not, then we will have to turn that call center down. You can give us a call. We're looking for hours between Monday and Friday, 8 to 5. So just if you're interested in that, please give us a call. We did request and had a DOH, our incident management team out of Region 6, Charlotte County, come out on Monday. And we had the nursing home residents on a voluntary basis, although I'm being told that all of the family and the residents did volunteer to be tested, about 160 of them for COVID, as well as a tag team, the TrueCore Level 10 OJOC facility, the juveniles out there. We've had positive cases both at the nursing home staff and residents as well as the juveniles. So just going ahead and being proactive and getting everybody tested so we can see what exposure we have so that we can start isolation protocols as necessary to limit exposure, further exposures there. So as soon as we get those results, we'll be able to move forward with any isolation protocols there. But everybody there is doing, in both of those facilities are doing everything they can to make sure they're creating safe working environments for staff and their patients and residents there. We have been made aware at the state that much like hurricane parties, especially in our youth population, college age especially, that individuals are having COVID quarantine parties. We just want to make sure everyone is not engaging in that kind of activity. That's not smart. Just make sure you follow the Surgeon General's advisory and avoid large crowds. Vulnerable populations, just making sure we're protecting that. It's not a good idea. Apparently what they're doing is they're inviting people who they know to be positive, inviting them to a party, and just with the intention of trying to make themselves exposed to COVID. The Department of Health has obtained and handed out 55,000 of the 67,500 masks. We still have about 12,000 to distribute. We've given them out to about 70,000 of our agencies and businesses throughout the county and city. If you are interested, if you're a business or agency that would like to get that out to our residents in the community as a public access point, please contact my public preparedness planner, Todd Hardacre. You can call him at 863-462-5805 and set up a pickup time to get on the list to be able to hand that out to residents in our community. We do have community testing sites available throughout the county. Department of Health, of course, is doing high-risk testing, as I mentioned, and that would be free. There is no charge at all for testing through the Department of Health. FCHC, our Federally Qualified Health Center, is also continuing to do testing. I announced at the county commission meeting last week that I believe they plan, or at least considering, to downgrade their amount of testing that they're doing at their Martin County site to just Martin County residents. So I'm not sure at what point they're going to be doing that. So just if you're going to consider going to Indiantown for your testing, just make sure you call ahead and just make sure they're still going to accept you as an Okeechobee resident in their Martin County site. I am aware that they have stopped their Tuesday, Thursday testing at their Pahokee site. Walmart is no longer have the grant to do their testing, but CVS is doing the same testing through their drive-through. You can see what appointments and check availability as far as eligibility through cvs.com. And Urgent Care continues to do testing as well at their site. CDC's recommended goal of 2% of the population as far as testing will continue through the months of July and August. So for Okeechobee at a population of a little over 41,000, that's a goal to test 833 individuals. When we say that, we do need to get out 833 tests. We talk a lot about, are we testing 833 individuals or are we administering 833 tests? The true answer is we're administering 833 tests. Every test counts on the dashboard until you get your first positive. As soon as an individual becomes positive for the first time, no additional test counts for that individual after that ever. For the month of June, with our goal of 833 in Okeechobee County, there was 2,106 tests administered. That counted towards the dashboard, and that would have made up 5.06% of the population, considering those tests, the number of tests that were done per capita. The pediatric report that's published on the dashboard, there were, of the 175 individuals under the age of 18 that were tested, 71 of them have been positive. That's a 40.6% positivity rate for pediatrics. That makes Okeechobee the 6th highest in the state for pediatric positivity rate. Antibody testing, we have done 149 antibody tests in Okeechobee. Those are ones that are FDA approved. There's 5 that have come back positive. That's a 3.3% positivity rate for antibody testing. That's the test that says, have you ever had antibodies in the past? Not do you currently have the virus in your system now. The state rate for antibody testing is 9.62%. So if you take a look at our positivity rate in Okeechobee County, it is currently 10.8%. So if you take our antibody testing rate of 3.36% and add that to it, it kind of gives you an idea of maybe, back in February before we were doing testing, kind of amplifying that rate. But I can tell you what research is saying now is that for the antibody testing rate, a positive truly is a positive, but there is a high false negativity rate, meaning of the remaining 149 that were tested negative, there's a high false negativity rate. So some of those might actually be positive that came back negative. So for our numbers for cases in the state, or in Okeechobee, we're at 451 cases. That's an age range of 0 to 93, 0 being newborns. That's 48% male to 51% female split, 9% black, 67% white, 51% Hispanic, 36% non-Hispanic, the difference being other or unknown. 0 deaths. We are still 1 in 6 counties in the state of Florida with 0 deaths reported. 4,106 tests administered, again a 10.8% positivity rate. Across the state of Florida, we are at 9.4% at the state level. In Florida, we are at 213,794 cases positive. 16,425 have been hospitalized with COVID, not necessarily because of COVID, but ever with COVID. That's 3,841 have died in the state of Florida. With a primary cause related to COVID. That's a 1.82% death rate. That has been going down with the number of cases of COVID going up. It's one of the factors we look at is the hospitalization rate, the death rate, currently now the ICU bed count. In the US, there's 2.9 million cases in the state of Florida, 130,000 deaths. That's a 4.42% death rate. Florida is the 3rd highest case count in the US behind New York and California. Globally, we've had 11,662 cases, over 539,000 deaths. That's also about a 4.62% death rate. I believe that's all I have. Again, just our call center will remain up and running for the rest of the week. You can call us at 863-462-5800, press 3. Again, I'm reiterating, the best thing that you can do to avoid exposure to COVID is continue social distancing. Follow the Surgeon General's public health advisory. Senior citizens 65 years of age or older with underlying medical conditions should avoid large crowds and limit exposure. Avoid congregating in large groups of 50 or more. Continue the infection prevention control messaging. That's the hand hygiene, washing your hands for at least 20 seconds with soap and water, keeping your hands out of your face, your eyes, your nose, your mouth, washing. If you don't have the ability to wash your hands, use hand sanitizer with at least 60% alcohol. Wear the face cloth masks. Stay home if you're sick, and then if you're positive, stay home. And when we say stay home, if you're positive, we mean self-isolate at home, away from the rest of your family, not with your family. Clean and disinfect frequently touched areas. Just pay attention to the symptoms. They've been updated on the CDC website. There is a lot of symptoms that you could have related to COVID. Including fever, cough, shortness of breath, chills, muscle ache, new loss of taste or smell, nausea, vomiting, the new ones are headache, runny nose, chills. And so just pay attention to those. If you have those, please call your medical provider, call the health department, or call any of the testing, but an in-testing site. Questions?
Tiffany, I think the big question we all have, I've had it twice already today, is you have to have symptoms to get tested. And do I understand that's health department rule, right, from the state health department?
No, it's not necessarily a health department rule. It's more capacity. It's the CDC guidance that we're following. It's definitely capacity as far as one individual capacity, as far as staffing capacity, contact tracing capacity, CDC guidance as far as symptom-based capacity, and right now as well as lab capacity. Across the state, the Bureau of Labs is backed up, as well as our commercial labs are backed up. We recently had our commercial labs tell us, please don't send us labs that aren't highest priorities with symptom-based. We have symptomatic labs being sent that are taking 8 to 11 days or more to get back. So not only are asymptomatic labs not getting back timely, but even our symptomatic labs where we have somebody that we suspect has COVID, not just asymptomatic testing to test them, but we have true exposures that we're wanting to see if we can get back. And I mean first responders that have been exposed that are symptomatic that are taking 8 to 11 days to get back. So the capacity in the labs are definitely being overwhelmed with the number of labs we have coming back, to the point where the capacity is at the moment being overwhelmed once again. So at the moment, that's the answer. So the health department here locally is going to continue to focus on symptomatic because that's the capacity that we have to do that with. Again, the rural communities have been challenged with this across the board. We haven't had the large rural, we haven't had the National Guard coming in to the extent of the drive-through testing sites that some of our urban counterparts have had. We've had challenges with getting the collection kits in the labs at the same time to the extent that some of our urban counterparts have had. So you know, we share with some of our rural counterparts some of the same challenges, but right now the lab capacity and the staffing capacity are our biggest challenges.
And this seems like we're fighting losing battle because I thought we were getting more, you know, when this first started, we were overwhelmed, and then it seemed like we sort of were catching up, and it seems like we're behind again now.
Yeah, when what in my experience is more positives come in, more people want to be tested. So, and not only more people want to be tested, but the contacts per person, we've experienced about 40 contacts per positive, true symptomatic contacts, not just household contacts where we're saying, please self-isolate at home. And that really, you know, times 10,000 positives a day across the state of Florida.
So if Councilmember Clark should tell me tomorrow that she tested positive, and I'm sitting right here next to her, and I shook her hand and so forth, there's no way I can get tested until I get sick.
So So if you're not symptomatic though, that's not the guidance. So with the amount of community widespread transmission that we have, the guidance that I'm giving you is to limit your exposure. So.
Yeah, but my problem is, I didn't know she was positive. I didn't know that till tomorrow.
Yeah. But so, you know,
I'm sorry, I'll leave it.
No. So, and I say this very, you know, non-panicky, is we really got to assume that the possibility is you could be exposing yourself. And that's why the guidance is, and the recommendation is you wear the mask and you do the hand sanitizer, the hygiene practices, because you just don't know. And you're taking these precautions and infection prevention measures to protect yourself and protect your family and protect each other as far as wearing the mask go, because you just don't know where the exposure is going to come from. And we do have community widespread transmission. And the reason that I think people don't understand, true asymptomatic aside, and asymptomatic meaning I'm just not symptomatic right now, I am never going to get my first symptom, is true asymptomatic. The reason you wouldn't necessarily test, and the reason we tell you to exclude from work for 14 days is because whenever the CDC says that you have 14 days, you really have 2 to 14 days after exposure. So in your example, you have been in contact with someone who's positive, and you know that you're going to take 2 to 14 days to have your first symptom, assuming you're not asymptomatic. So let's say day 10 is the day you're going to become symptomatic. Well, according to CDC guidance, 48 hours before is your pre-symptomatic period. That's when you would show positive on a test. So if you jump up and down on day 2 and day 3 and say, I need to be tested, I'll test you. You're going to come back negative. I'm not giving you a free pass to go to work. You return to work thinking you're negative. You're not negative. And you won't show up on my test as positive until day 8, day 9, and then officially day 10 when you have your first symptom. So it's, I'll just say a false sense of security that you tested on those first few days. Now, if you test asymptomatically, you will get someone who's asymptomatic or maybe in their pre-symptomatic period, which is the day 8 and day 9 in my example, and that's great. If you catch them, that's great. And there is a lot of people, as we're seeing, that are truly walking around, and spreading the virus with very few symptoms, headache being one of them, and not knowing it, and that's why we're saying wear the mask. And that's great if we catch them, but it's not necessary that you necessarily need to be tested just because you've been exposed and you don't have the symptoms yet. So, when we're in a situation where the lab capacity is overwhelmed and my resources are overwhelmed, I have got to focus on the high priorities that are going to overwhelm the healthcare system, and that's the capacity where I'm at right now.
And when you say resources, you don't necessarily mean test kits.
That's part of the resources, but where I'm mostly focused on is my staffing. At one point it was the kits. There was a point where I had staff and no kits. And then I had staff and then I had kits, but I had no lab to send them to. And there was one point where I had staff and I had a lab, but I had no kits to send it to. So I have to have the whole gamut. I have to have the staff to swab you, I have to have the kits to put the swab in, and then I have to have the lab to send it to, and then I have to have the lab that can get me the result back timely, because if I have to wait 11 days to tell you you're positive, I might as well tell you to go home, because 80% of you can recover at home and be just fine.
But wear your mask.
Wear your mask. Social distance.
Okay, any other questions, Tiffany? Yeah, Councilmember Abney.
Your results, do they include testing from the blood bank?
If the blood banks are doing antigen testing, those are the PCR tests, the serology tests, antigen testing are included in the case count. Antibody testing, so the antigen testing are, do you have it right now, the IgG and IgM. Antibody testing are not. Those are, have you ever had it before, but they are on the dashboard. So they are showing you, as long as it's approved by the FDA, it's a legitimate antibody test. They are showing you the antibody testing, it's just not included in the case count. but the antigen testing is the antigen testing, I'm not sure what the blood bank is doing, if they're doing the antigen or the antibody.
Testing while
They advertise that they're doing the antibody test, so that's what they advertise. If you donate blood, one blood, if you donate blood, that they are doing a antibody test. I don't know what, that's what they're advertising.
I can follow up and find out if it's the antibody or the antigen. I'm not sure which one they're doing.
Included in the result.
Either way, if it's the antigen, it's counting. If it's the antibody, I'm sure it's FDA approved. It's on the dashboard as showing the antibody result. But I'll find out. I'll follow up.
Other questions?
I have a question. So in contact tracing, you are testing those people that have been contacted, those people that have tested positive? Or
If
you're just telling those people to stay at home for 2 weeks?
if we're telling them if they're in close contact within 6 feet for more than 15 minutes without a mask, that they need to self-isolate at home for 14 days. If they become symptomatic, then we would bring them in and have them tested.
Only if they became symptomatic. How many of us stay home for 14 days?
Well, it's not really 14 days because if you're exposed on the second day, then you may get 16 days.
14 days from the exposure.
And just
From the
a
last
personal
exposure.
experience, just let you know, my brother and his family, firefighter, nurse, respiratory therapist, all ended up with COVID-19. They were positive for 32 days. One of my brother was in the hospital in ICU. He caught it from his 7-month-old grandson that had a fever for 24 hours. That was the only symptom. So they ranged in age from 7 months to 54. 32 days, all of them, 9 of them.
And it's a good point, is we tell them to self-isolate from the day of last exposure. And it really is hard when you have kids in the family. It really is very difficult to isolate from your kids, and especially with the single moms, the working poor and the marginalized, they always suffer the most during any pandemic, any public health emergency. It's very, very
So my next question is, then why are the other small communities allowed to test without symptoms?
It's not a matter of not being allowed to, it's having the resources to be able to.
We're not gonna stop the spread unless people
Stay away from work. Yeah, it's definitely not allowed to, it's having the resources to be able to.
Okay. Tiffany, thank you very
Okay,
much.
you're welcome.
Appreciate
Thank you
it.
for having me.
Good luck. We know you're working hard. So
All right,
thank you. Thank you. We'll move to the next item on the agenda, which is new business item B. A request by Okeechobee Main Street to install 2 4x8 signs in park number 5 for the Cattle Drive sculpture project for approximately 1 year to waive any applicable sign permit fees. And I see Kathy is here to discuss that with us. So Kathy,
Yes.
Exhibit 6 in your packet, and Kathy, you have the floor.
Okay, yes, good evening. I know y'all are used to having Bridget Waldo here doing the Main Street Agricultural thing, but Bridget couldn't be here tonight, so I'm filling in for her. And just for the record, I think most of you know who I am, but I am Kathy Scott, and I'm also the Vice Director of the Arts and Cultural Alliance for Main Street. Okeechobee Main Street Arts and Cultural Alliance's Cattle Drive Sculpture Project is in progress with the goal for installation in 2021. We would like to place future home of signs in park number 5 so the community is aware of where the sculpture will be and to show that the project continues to move forward. A project that will give the community something uplifting to look forward to in the future. There would be 2 4x8 professionally printed signs, and one will face Highway 70 and the other towards Park Street. We did an aerial view in your agenda packet. The signs will be constructed to withstand the elements and aesthetically pleasing to the park landscape. And naturally, the sign installation will be coordinated with Okeechobee City staff. We ask the council to approve Okeechobee Main Street to install these 2 signs in park number 5 for approximately 1 year and waive any applicable sign permit fees. And so with that, if you have any questions, I'd be
Okay,
glad to
any
answer them.
questions of Kathy before we get up here for discussion? I would just like, for the record, I would like to say that we got a letter, you were provided a letter this evening at your place from the Economic Council of Okeechobee. I will read it into the record. Mayor Watford, the Economic Council fully supports Okeechobee Main Street's Art and Cultural Alliance's request to install temporary signage in downtown Flagler Park number 5 to continue fundraising and gathering community support for the Cattle Drive Sculpture project. This art installation Main Street has taken the lead on will contribute greatly to our downtown area and will be an impressive attraction to draw visitors to the city. Sincerely, Jennifer Tewksbury, Executive Director of Economic Council of Okeechobee. Okay.
And we greatly thank them for that support and that letter.
Okay. Any discussion from the council, or do we have a motion to approve? I would just like to request that, of course, I know you probably don't have it yet, but we don't have the wording that would be on that sign.
I did submit it, but someone didn't attach it to the agenda, but I brought them with me, so if you would like to see them, I have it.
Well, I would just like to say, I'd just like to be sure that city staff approves that wording.
Actually, I wanted to make sure, Mr. Mayor, I want to make sure you guys had this prior to it going in, so you were aware what the sign was going to look like. We didn't have this.
Make a motion. We
have a motion to approve the request. Do we have a second? Motion by Councilmember Gerald, second by Councilmember Keith. Discussion. My only question is, would it be better to have a picture, like the picture of what the sculptures will look like, rather than a real cattle?
Yeah, well, we are kind of doing some remarketing right now. We have used the sculpture pictures before. The problem is right now we're in the process. The artist has been commissioned and he's starting to place sculptures. So we actually we won't have our Cattle Drive sculpture view until they're done. And we really don't want to put the pictures we have now are from the villages up there, and we just thought it would be better to change it up, have it more graphic looking and something to get somebody's attention. Because unfortunately, we don't really have a piece that we could photograph right now.
Okay. Other discussion from the council? Okay, we'll vote on the motion. All those to approve motions signify by saying aye. Aye. Opposed, motion carries. Thank you, Kathy.
Thank you, Kathy.
Thank you all very much, and I'd like to just take a quick opportunity to remind everyone that if you have not donated or sponsored a brick or a plaque for the Cattle Drive sculpture, please do so. If you're not familiar with the project, you can call Bridget, myself, Angie, Linda. We'd be glad to talk to anybody about it. So we naturally, like everyone else with the COVID-19, we've kind of got put on hold and we're behind some. But we're going to be working virtually, so expect phone calls. We can meet with you over the phone. So if you have not donated to the project, we certainly would appreciate your support so that we can get this done for the citizens of Okeechobee.
And any amount is appreciated.
Any amount is appreciated.
Can that be done online on the Main Street website?
Yes, you can go right on Main
Do a
Street.
sponsorship and donation or what have you?
Yeah, all the information is on the website, and then for those that may not want to do one of the sponsorship levels and just donate $20 or $10, there is a GoFundMe also,
Oh, great.
that they can also do that.
Thank you.
Thank you, Kathy.
Thank you.
Thank you very much.
Everybody stay safe.
Thank you. We'll continue on the new business. Item C, we need a motion to rescind the designation of Fire Engine 5 as surplus and its donation to St. James Lanark Volunteer Fire Department and transfer Engine 5 to Public Works Department to replace the T-2 water truck. And you have that in Exhibit 7 of your packet. So do we have a motion?
Make a motion.
Have a motion by Councilmember Clark, second. Second. Second by Councilmember Keith. We'll open it up for discussion. Mr. Administrator.
I can answer any questions. We've worked, I know, kind of tirelessly with that city up in the Panhandle. They were able to do transportation for it. In the meantime, actually, you've seen we had a very severe damage, or I should say damage, but a maintenance issue on the old water truck. So this would fall in line just to repair or to replace that.
Okay. Any other discussion?
So
Councilmember Evans?
Yes, so they know that they're not getting it now?
Yeah. I'm sure they've been notified. We've notified them 100 times. I was just at minimum, and I'm not making it jokingly.
Messages, we emails, texts, everything, we're not getting any return calls or attempts at all.
Just make sure you do send a final email that, you know, we rescinded, so they know that it has been rescinded.
Yeah, return receipt.
It's odd, they're not responding.
Yeah. Okay, any other discussion? All those in favor signify by saying aye. Aye. Opposed, motion carried. Next item under new business is item D, renewal of the public risk management group health insurance exhibit. That's exhibit 8 in your packet. I don't know who's going to take this discussion. Finance Director, Mr. Administrator, who's taking the discussion?
I'll just start while India comes up, but just our 3rd year renewal for the same contract we've had. I'm on our PRM health insurance, the same PRM group we've been involved with for a long time, and I know we actually have good news on rates for this year. So I'll let India go more in depth.
I did provide a memo that states what our current rate structure is for employees, police, children, spouse, and full family, and then what the proposed rates that we're asking the council to review and look at. It is a 4.5% increase from last year. Any increase, we just weigh on our shoulders, but actually Marcus and I are very happy to provide only a 4.5% increase because in the last 2, 3, 5 years, it's been double digits. We believe that one of the key reasons for this decrease is that the city council did implement 3 years ago a benefit services benefit through TCMA, which allows our current insured employees to go there without cost. So I think that they're going there and getting antibiotics for free if they have them at TCMA, which drives our costs down, not just for the office visit or the meds, to be honest, but they're going early and getting tested and actually getting well quicker. So they're not ending up in the ER and things of that nature. Also, we didn't have very many large claims this year. We have had large claims in the past, and that's increased our costs. So again, any increase is not good, but a small increase is better than that double digit. So we are asking to offer the current plan of 0727, and then we continue to provide the Affordable Care Act option of 05901. I provided no coverage changes or benefits changes, and I provided the 2 plans documentation as well. Happy to answer any questions.
Yeah, with me off the plan now, we all really ought to go down now.
I can't comment.
Yeah, I know, that's a what's that? That's the law on the healthcare. HIPAA, yeah, that's a HIPAA violation. Okay, do we have a motion to approve the renewal of health insurance with Public Risk Management Group? We have a motion by Councilmember Evans, second.
Second.
Second by Councilmember Clark, and that's to provide the same insurance that we presently provide. Any other discussion from council, questions? Hearing none, all those in favor signify by saying aye. Aye. Opposed, motion carried. Item E, the next item under new business is we need a motion to approve addendum number 3 to the contract for medical services with Treasure Coast Medical Association, Inc. And that's exhibit 9 in your packet. And Mr. Administrator or Madam Finance Director, who's taking this?
This is the one I was alluding to begin with, and I'll let you take over. This is a renewal again for the TCMA, the Treasure Coast Urgent Care that we have been working with in the past. I just want to say, well, then we go through the numbers again, but this is one thing that we started 4 years ago or 3 years ago. But 4 years ago, we were seeing healthcare, just for the council's information, almost 15% increases every year. And it was something that we had to implement some kind of program to offset that. So this is one of those programs that we're starting to finally see the, come to fruition of actually starting to see the dollar savings. Again, this is the third year we've done this. Again, looking forward to the future. DWPRM came and kind of told us, hey, you guys are on the right track. Thank you. Because they don't want to charge us anymore, believe it or not, because they're run by us or by its members. So again, thank you for providing this for our employees in the past and to continue forward. So.
Finance Director, do you have anything to add to that?
If I may, I did want to let the mayor and council know that Kelly Alberg and Laura Rubio are on Zoom. So if you have any questions for them, they're representatives of TCMA and the contract, and they wanted to make sure that they were available if you had questions.
You understand that they would be here available by Zoom. So thank you for, if they're listening, thank you for joining us. And this council, do we have I guess we need a motion to approve or the addendum number 3.
I'll make a motion.
Have a motion by Councilmember Clark, second by Councilmember Abney. Now we'll open it up for discussion. Do you have any questions, or if they're on Zoom, would they like to give us any comments, or first we'll ask the council if they have any questions, or seems like this has worked very well, extremely well, I think. I know the times that I have had to use that service has been fabulous. I understand I'm no longer eligible. Okay, and no comments for Zoom?
No, sir. They're on here.
Okay.
No, sir.
Okay. Any other comments from the council, questions? Hearing none, we'll vote on the motion to approve the addendum. All those in favor signify by saying aye. Aye. Opposed, motion carried. Thank you very much, and thank you for being on Zoom with us, and we appreciate your service. The next item is item F, update on the EMS budgeted services. That's Exhibit 10 in your packet, and Mr. Administrator will let you, I guess, start the discussion.
We went through, obviously,
this was a question from our last meeting.
Yeah, this request from the last meeting. We was asked to take another look at EMS with some updated information, updated items based on our discussion with the county, and move forward. I tried to take, and India and I sat together and went through this to make it a little bit more easier to read. I think the data is pretty much the same. It's a lot easier to follow now. What you basically see is a general fund, how you would see a budget for us, the first 2 items of the exhibit, which would be what would change staff-wise by adding 2 additional paramedics. The first year, because of the county, we did, however, remove the additional $7,000 that we had put in there prior because we paid for their classes. So we pulled that out in this one, along with the applicable benefit pay, I'll say pension, FICA, et cetera. So you see these numbers are slightly updated from last time, a little over $90,000 in that range. So it dropped our expenses a little over $90,000 in the actual labor portion. On the second page would be the actual budget items. We did have a small reduction in professional services. We actually got a stronger quote from the actual medical advisor, supervisor, which dropped a few $1,000s. The other items have been pretty straightforward from a budgetary standpoint, if we were to do EMS. So that you have the budget, and I mean, it's a little bit difficult to understand, but that's the budget. So you only see the expense side. There is no revenue side. It's all, it's any typical budget where you see all expenditures out, any revenues are going to be in a completely different side. So we took a look at the county. The county did give us data, actually very detailed data on calls within the city. If you can kind of see the EMS revenue versus their budget versus actual in the county's chart, which is the next exhibit. So you kind of follow along. They're pretty close with what their budgets are compared to what their with their revenues. All right.
Which one are you on?
I'm on the page 3.
Chart.
I'm on the chart on page 3. The color chart.
The blue and
blue and yellow.
Thank you.
I'm just trying to, I just wanted to give some, the data up front because I'll give the actual, what we chew out of it into, which would be page 4 of that exhibit, is the County Fire Rescue EMS calls within the city limits. Is basically taking that data and giving it more in a raw fashion. And India did a fantastic job. I couldn't tell you how many hours she spent on pulling that specific data out and coming up and crunching these. But we wanted to do a forecast, so it's not just 2020, it was 2017, 18, and 19 to look at that. The county also broke it out when you see the terminology. ALS is advanced life support and BLS is basic life support. So it breaks it out with calls, what they were billed, what their gross billings were, and what they took in, and then the percentage of what each calls for those services with what payment they would get it from. So when you have the Medicare, Medicaid, private insurance, and self-pay, those are different rates. So just because we say, hey, it's $500 a call, if it's a Medicaid call, you're not getting that. So, I mean, it was important to understand what percentage of those calls were, so we're not thinking that we're overestimating what our revenues would be. So that's basically the breakout of that data.
Question, on the one where you got 17, 18, 19, you got total calls and transports. Are the transports part of total calls?
Those were transports of the total cost.
Yeah.
Okay.
Yeah. Now, in addition to that, there's that data for 2019. This is emergency calls, not sub-calls. I'll say non-emergency calls. Because if you know, I mean, there's a fact sheet, and there's roughly 1,200 transports, which we'll see on the next page. We only count for 900. There's actually 1,200 because some are non-emergency calls. There are calls, health department calls, specifically we need to transport to the hospital. It's not a 911, it's just a transport, which we would be doing the same thing. So, all right. If there's no questions on.
I have questions.
Okay.
I was waiting for you to.
Okay.
Okay.
Because I want to go to the summary, and that's where it kind of wrapped up.
Mr. Mayor?
Yeah.
If you can go back to the first page, please. My question is, you made a comment that we did not include $7,000.
Yes.
Are you saying we did not include the $7,000 increase for the personnel because they're now paramedics? Or we didn't include $7,000 because of the school?
We did not include $7,000 apiece as paramedics. Period.
Okay. For pay or for school?
Period. Either way.
For neither one.
For either.
So the salaries are not going to be correct. They're going to be higher than this.
I guess my understanding is this would be the same apples that if our guys would leave as paramedics and go to the county, it would be the same dollar transfer. That's why we didn't put that in. That's why we actually pulled it out of what we had before.
Okay, are we going to be discussing the counties or not tonight?
We can. I just wanted to give the update to make sure it was apples and apples, that our guys wouldn't get an increase because the potential right now is not getting an increase at the county.
So that's confirmed.
So paramedic will not get paramedic pay, is that what you're saying?
As of right now, the understanding is in the meetings, I may be off on that, but the meetings are whatever their pay is now is what they're going to go to the county. And unless I've heard that, I mean, now I haven't heard anything differently on that. That's why I pulled that number out specifically.
Okay.
We need to clarify that.
Well, and I think that's why I'm presenting this, and then we'll go through, when we talk about the fire services, there's specific items I'll need to get direction on before we go back. At the end of the day, when I go to the summary sheet, put $100,000 in their difference. So we know that cost, what it is, we know rough number 90 to 100, we know what that cost is if we were to increase pay.
Okay, so what we're saying is, this does not include, so if we, well, we haven't
Does
had,
not include a supplement for the.
paramedics, but why would you not include that if we're running EMS? They have to be paramedics.
I was just trying to be consistent with what, if they were to go to the county, what the pay range would be. It'd be the same thing. Since we paid for their class, they're not paying us for the class. Same way we would go to the county.
Okay,
we
so
would get
the
additional
county gave
increase.
us that information that they're not gonna pay them as paramedics?
Our discussion has just been with the salary they are now as paramedics that we're going to slide over. And we'll touch on that fire. But that's been my understanding, at least the past 2 meetings, because I know we've given them the salary sheet.
Okay.
I'm looking at it down because I'll make sure I'm not saying misspoke, but that's what they said during the meeting, so I'm just trying to be consistent. All right, make sure I didn't miss that, because I may have missed that too. On that first page, we did add 2 paramedics. The idea is we are going to have that second run available, and we need someone who is a paramedic on that, at least a little bit of experience, so they did add 2. But that is included in these numbers, as it was in the previous set.
Okay.
All right. All right, I'm going to go down to the wrap up, because I think this is where bringing everything together.
Well, I'm sorry, I did not understand the chart totally. So what you're saying is,
The breakout on the sheet below it, I think, is a lot bit more representative with numbers than just the chart. I like the chart because it shows you the revenue and expenditures for each one of those years,
okay.
or for 19 and 20.
All right.
And that's countywide, not city.
Yeah, correct. Now that's countywide. That's why we kind of honed it down. We got data from the county. We honed it down just what data in the city was. There is one item, we'll go to the, I'll get there, the draft EMS revenue calculation. So this is the summary. Again, last time it was very convoluted. I had pieces coming in from this and this to try to say, this was the one sheet that everything came down to. So your professional services and what their costs would be to actually do the collections for the EMS. We'll have a third party that would do those collections. We have the total costs, the fire medical costs, what we had, and the data from the county were 907. However, it did not include private transports. So that number is actually around 1,200. It's actually in the Economic Council's sheet. It's 1,208, I think is what the total number is for actual transports. So that number does increase, and I'll touch on that. We broke it out to what percentage of the calls were within the city. It's about 73% were transport calls. And the average billings on those with Medicaid, Medicare, self-pay, literally the gambit, how the county presented it, was about $477 per run. So your gross billings are about 433. If you count the 1,200, you're about 600,000. So just so you know,
Wait a minute, what's 1,200?
if you take the 907 that we had,
Oh, okay, gotcha, okay.
and you actually bump it up to the private transport, so you're 1,208, you're at 600,000 roughly. So 433, 6, you can almost put it a wash if you want to look at that way for personnel, if you want to do that later. So there's 150,000 that's in there for the additional 300 calls. So again, your net billings, you're getting back about 76,000, which is 82% based on the data from the county. I know the county, and I know the data they've shared is they're getting about 52 or 53% of their billings. We have I'll say a better demographic, and I'll say auto accidents do take a large portion of this, as well as transports from the nursing home. So we have a lot of those items consolidated here. Those have payment, have a higher payment response than others. So that's why the billing rate from the data we got from the county is at 52, 53, it's 82%. So your net based on taking that out is 360,000, 357, 875. Conservatively, again, if you went back to the actual hard data with the private transports, you're about at another 150,000 today. So you're about, again, 500,000. City purchases, we spoke about this on what our capital purchases would be. They haven't changed much. One of the items that I know the fire department's been working on is either, and we can't say it here, has been grants, because we haven't authorized them to try to get the grant, but just, hey, if it's upcoming. Same thing, we do have some equipment on loan that we may be able to spread these costs over under life packs, and some of the equipments that can go over a couple of years with some neighboring communities that are willing to help us. From a planning standpoint, I know Indy and I looked at it, that it's going to cost us roughly $50,000 a year for 10 years. So it might be 400, but say about 50,000 for budgeting purposes over the next 10 years. So it's not free. We're looking at, okay, so you take your 500 and you subtract your 50 from it. All right, so you're about 450. So what does that equate when you actually break down the numbers on the last sheet? We know that the budget is going to increase. It's not hidden that if we do EMS, our budget's going to increase to to 1.89 for the fire department. We take out the dispatch, which I think we're gonna shift over to the police department anyway this year. We look at the draft revenue calculation, and we'll just go with the 900. I'm not putting extra 150, just the 900. And then you take out our budget, basically roll forward that we've seen historically, and you're about $785,000. So it's about $1 million when you have that net effect. And I know this is, I've had a lot of questions on this. It's because now the city will not be providing, or the city will now be providing EMS, so our citizens will not be paying the assessment. So when you factor out the assessment and you say, okay, citizens, you guys no longer pay this $344, it's basically paying for the fire department and EMS in its future rate would equal about what the citizen is paying currently with millage and assessment. And everything that they would do during transport, any dollars recouped revenue-wise, would be dollar savings to the city or to the citizen. So since the numbers are close, when it comes to assessment or transport, you can change either one into what the additional cost would be, but you pull the other factor out to know that the citizens are either going to pay the $344 or they're going to save whatever you made in transport. And that's, I think, the sum of it. And I think we were conservative on transports, again, because we didn't include the private transport side. So that's the new sum of EMS and questions. And so I think Indy and I know these numbers backwards and forwards now. It's tough to grasp about the 344 because we never see it, but our citizens do. And that's why it's kind of tough to say, well, 344 is actually over $1 million when it comes to what tax it is for us anyway. So that's why we don't see it. It's just our citizens do see it on their tax bill.
Okay, Councilmember Gerald.
I'm sure you're conservative here. To me, it's just a washout on what we collect on transport and the assessment. But what is, it's conservative also. What you show is $1,869,000 as an expense. I know it's not going to be less than that. I know it's going to be more. And I don't really know why we're discussing this when a year ago we started this discussion and we still don't have the figures from the county. So I don't know how we can make a discussion on this and talk about it. I'd like to talk about it after we get the information from the county, but I think it's all premature.
So we were,
I asked.
we had a request to have this on.
I understand it, it's good information, but I know you're conservative on both. You're conservative on maybe on the revenue, but I know you're conservative on the expenses too. And any way you look at it, it's adding $1,869,000 minimum to our budget. So, you know, I'll be glad to talk about it, but there's a lot of things I'll be hitting, but I'm not interested in going into the details now till we go to the county and answer the questions they ask for.
Okay, any questions from any other council members, or you want to have any other discussion this evening, or?
I have questions. I'd like to give the minister at another time, but bring it back up again. I think we can put it together tonight. I know we have other things to discuss.
I would suggest if you have questions, you kind of get with the administrator. You might do a better one-on-one, with the administrator. I'm sure the finance director would meet with you also.
I should just sound like India sitting there, because again, we went through the numbers. It's difficult to go through at this level and see what it is, other than you're mixing raw data with some projections. And some of it's not even our money. And that's the difficult side.
Councilmember Clark, you had asked this to be on the agenda.
I did.
Is that sufficient for you?
Well, I did because I think our every time we have a meeting, our fire department says, are you not looking at these numbers? And I wanted these numbers to come back in front of us so that we knew, I did in my mind, what we're talking about, whether, what the possibilities are, and that's what I was looking for. I agree. I think, I don't want to go in line item by line item, but if we're going to be running, ambulance and fire trucks, our fuel and oil is definitely going to go up. And I noticed that that has not gone up. Tires haven't gone up, so I think this is very conservative. But I also feel like on the revenue side, it's very conservative. I just think this whole thing should be a lot more simple, and it's not, because we still don't have the real numbers, like finding out that our guys aren't going to be paid paramedic pay when they're going to paramedic school. That doesn't make any sense to me. But this is what I asked for, so I appreciate it.
And just for my clarification, on the last page, Mr. Administrator, this net drop in revenue based on millage, would you just explain that 1.6?
Okay.
268, is that what you're saying, that with the additional revenue, potentially, that would equal 1.6268 mils?
Correct.
The potential with the
potential drop, obviously, because we are adding, on the way we have it presented, 226,000 for additional costs. You're offsetting that with 357. So you're able to drop 1.2 mils just with the conservative estimate on transports. So we're looking at about a 7.1. So that was the initial drop from the implementation. And again, we do have to look at, though, a citizen standpoint. This is where I always get confused back and forth with the two, even explaining it 30 times now. The 344 is still a true cost that our citizens would see, but we wouldn't. So it's just it's a cost savings to the citizens. It may not be dollars to us, but it's a cost savings to the citizen, which is about 1.178 again drop. So you're about set with additional services.
All right. Any other discussion on this item? Okay. Thank you for the update. Appreciate it. And I would just suggest that I know I plan to schedule a meeting with the administrator just to sort of make sure I understand this correctly. And I would encourage you, if you have questions, to do so also. Okay, that will take care of that item. We'll move on to item G, discussion regarding fire service exhibit 11. We also have a letter from the Economic Council. I'll read that into the record. On this item, Mayor Watford, the Economic Council of Okeechobee continues to support a contract for fire rescue services between the city of Okeechobee and Okeechobee County, as stated by Ms. Torrey, and someone's going to help me with that. IAFF District 12 representative at the May 19th, 2020 City Council meeting. Many other municipalities have recognized the long-term economic benefits provided by an interlocal agreement of this nature. Our small fiscally constrained community cannot continue to ignore the costs, advantages, and increased efficiencies available to us through basic economies of scale. The proposed alternative to instead implement EMF services in the city is inherently the direct opposite of this widely understood economic principle. Thank you for being engaged in this discussion and for being transparent to the public in your decision making. Respectfully, Jennifer Tewksbury, Executive Director, Economic Council of Okeechobee. Okay, I'd like to lead this discussion. You have an exhibit, and what we tried to do, as we had our workshop with the county, of course, we couldn't make any decisions then, And so we wanted to bring it back to the council, and these were the things that we kind of discussed in our negotiation team. And so we need to see if we as a council agree with these proposals or want to have any, I guess, additions or anything we need to add or change to those proposals. The first is the assessment proposal. That's the study, correct?
Yes.
And that is in regards to having the contract amount be the amount that the city residents would be assessed if they were under the fire assessment. And we kind of agreed that they've redone their study, but it should include the city. That may change the figures with the city property. So I guess that maybe the first thing we need to do. And are we kind of in agreement? And what was that? $8,750. $8,750 is the city's portion, or would be the city's cost to be included in that study. But I guess, of course, we're not to that point that we would approve that. But do we kind of agree with that?
Mr. Ricker, I just want to bring that up. That was item we brought to the council back in January, February. We did kind of consensus not to sign it. And again, it's within my signing authority. However, I wanted clear, each one of these items, I kind of want more of a clear, decisive item so we can either move forward or just come back. I mean, that's the whole idea of this. So it's either move forward on the proposal, and I don't know how we do this, do you do a consensus or to say yes, go forward on each item, or what we do, so I can start either, again, moving the wheels or hitting the gas.
I think we're going, it's within your spending authority. I think if we get a consensus of the council, I mean, of course, you could do it whether we said yes or no, but I don't think we said no, but I think we need to have a consensus from the council that first of all, do we all agree that that's the the figure we want to work towards, rather than do the long contract like they did the budget and so forth? Just do that's what the economic council has proposed. Council member Gerald.
I think it's very important we do the study. Either way, it's going to give us the information we want. I think we paid, $45,000 last time for the study. It may not be the same study, but at least it's going to give us the idea.
Yeah, Councilmember Evans.
Yes, I agree. I think that we need to move forward. If we're going to base our fee on a fee schedule basis, then yes, we definitely need to be included.
I agree.
I feel that it will bring down assessment across the board for the city and the county. But I'll read back in number 2, it says, city desires to use the county fire assessment rate as a basis for the fee calculation for the first year. Why only the first year, not all 5?
No, I think, and I didn't bring that with me, I don't think. Is that, yeah, Terry's. I think that was Terry's wording. I think what he meant was, and like I said, on that front, was that if we don't have the assessment, we would use the county's figure. We would use what the county assessment would be.
Okay, if we didn't have, if we didn't have the study.
The study, and I'm not sure how long the time frame is going to be. Depends on how long this takes to put together.
I understand that.
Okay, thank you. So we're Council. Okay, so we have a consensus that.
Yes.
Okay, thank you. Okay, the county wanted to utilize the city fire station. Now that's probably going to take some negotiation there, because number one, it depends on if we want to allow them to continue to use it. Originally, we had, the original proposal was they wanted to use that facility to store equipment. There's been some discussion that they may want to, because they will have increased personnel, they may want to use the whole facility, much like it's being used today, to house employees and in fact, to answer calls from that facility. So do we want to allow the county to do that? Use that facility, and then I guess we would have to have a discussion on, do we expect reimbursement for cost, or?
What I was kind of looking for, it's either yes or no, and if it's a yes, we'll work that out with the county. I'll work that, it's gonna be whatever the building would be. We know we both have the same insurance with PRN, so we'll be able to work all that detail out.
Yeah, electric. And
Yes, sir, yes, sir. And if it is a yes, for how long?
Yeah. Do we want to allow, I guess we're looking for a consensus again.
I'm good with it.
Okay, looks like we're good with it. We'll negotiate cost, and if it's something, I would assume that they would want to use it. And I don't know what their plans are to build a new facility, but at some point they would probably build a new facility, and I would assume they would probably won't to use it until that time. But that, there again, that's something we can. Okay, so we're making progress. Okay, city to continue to pay for employees to be paramedics. All those that are, the problem is a couple of the employees are not paramedics, but may be transferring over. And the theory was that, we had offered to our employees to pay for their paramedic training, and if they elect to go to the county, that those employees would need to be paramedics, and the city would pay the costs for their training, just like we did our current employees that were paid for.
My comment is on this one. If it's in the 7 that they need to provide services for the city, and those 7, not all of them have had the opportunity to go to paramedic school, I don't have a problem, because we're paying for 6 right now, so that means we only have 1, right? That might not have his paramedic. Well, or if they don't all go, okay? But if they're within the 7, I don't have any problem with it. But if the county has openings and they choose to hire our people, then why would we continue to pay for, because they would be county employees, not part of the city transfer.
They're not going to hire that employee if he's not a paramedic.
Well, that doesn't make sense.
And the other issue is, for example, and that's something that has to be on the union side, would be their rank. But like lieutenants, that if they transfer over, I think we have 1 or 2 lieutenants that are not paramedics and are not taking the class. But if they choose to transfer to the county, if they won't have that, they need that paramedic training.
Again, okay, my comment is if there are the 7 people that the county says they need to provide our services in the city, then I think we should cover those 7 people. But if they are filling the position that the county has, an opening that the county has, I know they had a notice in the newspaper for an EMT, so they're hiring an EMT. They choose to hire one of our EMTs over and above the 7 employees. I mean, it should be a county employee, not a city employee. I mean, they just happen to work for the city for a year and maybe are hired by the county. That's my comment. And that goes.
How about if it were worded, the city would pay for the paramedic training, with the exception of employees that are hired as EMTs. Hired only as an EMT. What we were trying to do is protect our employees. The county has pretty much told us they're not going to hire our employee unless they're a paramedic.
I understand. And we offer that to all our employees except for the brand new employees. That's what I understand.
Yep.
The only ones that are not in the paramedic program are the ones that decided not to go to the paramedic program, or they're so new they missed the entrance day. Is that correct? Is that correct?
Correct.
Okay. So that means they're brand new. They've been here a year, right? So I think we've made the offer, and if they're part of the 7 that are going over to the county, I don't have any problem taking care of them. If it's not one of the 7, then I don't want to be paying for the paramedic training. Okay?
We'll ask for consensus.
Mr. Mayor?
Yeah.
If I can just add, not in opposition or protagonist or antagonist, just a recollection of council approved to pick for the 10, up to 10. Yeah, and that covers, I think, the fire department. So we approved that, last year. If that's, if that covers, firefighters going over, city personnel, just throwing that out there. We approved previously to pay for 10 paramedics.
But Councilmember Clark said they'd no longer be our employees, they'd be county employees.
Right.
At that point.
So were you saying that you would be willing to pay 3 more then, to make it 10?
4 more, we paid 6, right?
We're paying for 6.
Paying for 6,
We're paying for 6. We previously approved 10. Well, just throwing that out there. Just as chew on that stuff.
Well, we have 6, now he's gonna hire 7, then I know the inspector is gonna be required to be an EMS because they're, or a paramedic because he's gonna be in the mix too. So it would still be a 4, but it.
So let's see if we can get a consensus. Do we want to pay for paramedic training one way or another, or up to 4 or up?
Well, we were also talking about them taking the additional at the city's cost and let attrition work its way out. That's really 4 people. And if they're gonna take them, they'd have to be paramedic trained as well, correct?
Yes.
Yes.
So if we're trying to cover them all, then I feel that if we were gonna pay for the additional people over the 7, and they're requiring to be paramedic, then I would say that we would have to, like, Councilmember Keys saying, up to total 10.
Okay. Okay.
Because
That's fine.
Councilmember
That's
Gerald?
fine.
I don't have a problem with 10. 10 is fine.
You already approved it.
So yes.
All right, now the next one's kind of really nothing for us to decide. The county is coming up with new metrics, to track performance. One thing we were concerned about, response time, so forth. And with what we were told was with their current computer programs, they really couldn't track that adequately, so they're going to redo those metrics so that they can assess those and give those reports to us. Because I think that's one of the things we had asked for and we wanted was continued reports as we go along. Any questions there? Okay, the next one's a tough one. The city covers salaries and benefits for other employees transferred above the 7 anticipated. I think we had said we wanted to make our employees whole, make sure that they were covered. So what the county agreed to do, or what our team worked out, was that some of our employees may not want to go or may not go. Or we may have other, and that's something else we need to discuss, we may have other options for some of our employees. But our theory was that we would cover, let's just, I'm going to take an example. Let's say they need 7, and let's say they hired 9. Let's say 10. Let's say they hired 10, so it's 3 additional employees. We would cover their salaries until the county had attrition. So let's say a year from now, they lose a firefighter paramedic, so they need one of ours. So now we're only, instead of paying for 3, we're only paying for 2. Another one leaves or retires or whatever, they move that one up, we're only paying for 1. And at some point, we would not be paying for anybody's salary. But until that attrition took place, we would cover that employee, the salary for that employee above the 7.
It doesn't say anything on here about attrition, so.
Uh,
It says any employees
Yeah,
over 7.
yeah, I'm sorry, I guess we didn't know.
Okay.
Yeah, you know, maybe that they have 3 firefighters leave a month after this takes place, well, then we're off the hook.
Okay.
Is that agreeable?
Yes.
Okay,
Agreeable.
all right, do we want to go ahead and cover, Mr. Administrator, let's cover, while we're here,
Yeah,
let's cover, what do we want to offer? We have a couple of employees that are in drop or some that,
I'll say that we have, and just because we're on the cursory, I haven't spoken with the 3 that are in drop. I'll be getting with India, I've given kind of a sample on what that, maybe, I don't know the exact terminology other than, buyout or whatnot you want to look at for those 3 employees.
well, that's the thing we need to decide if we want to do that.
Yeah, and that's up to you guys, or again, if that's not the case, then we're gonna pay for them to go to the county, and that doesn't.
Do we want to consider a buyout?
I would consider it, but A, I'd like to know if they want it first.
Yeah, that's what
B, what.
How much is it? Well, and there's a lot involved in that because, you know, somebody's got, I'm gonna fix some figures out there. Let's say that they're in drop and they've still got 4 years left. That's gonna be a big amount. We're not gonna give them the whole 4 years, are we? We're gonna say, okay, yeah, we'd offer, exactly, that's my thought.
Yeah.
You wouldn't say, well, we're gonna pay you salary for 4 years, that but here's a pack or something we can offer you. Okay?
If they're interested, yeah.
If they're interested, yeah. Okay? That give you enough, Mr. Administrator?
Yes, sir, and attorney wants to address the last item that would be in there.
Okay.
On the pension part?
No,
We're not.
no, we're not there yet, this is under the,
Oh, okay.
So I sent all of you a memorandum at the request of the mayor, just giving you a very simple
Okay,
overview.
let's don't get to that discussion yet.
oh, okay.
Let's get that at the end. I think I know what you're starting to say. You're talking about the memo I asked to send. Can we get that at the end?
Yes, sir, we had it just noted up there on top, so we'll
Okay.
go through.
Okay. All right, pension,
Pension options, I just wanted to let the council know, I've spoken with the county on a couple of items. Just the one item that kind of glared out before is if they weren't vested, that we would treat it as they were not, and again, this still has to go for discussion and further discussion, is they wouldn't be vested, they would get the payout, either roll out to an IRA or whatever they would like to do. For those that are in the pension invested, we have some options to go through. It's positive for them, and I think it's, you know, we just need, as a council, when we get further into this, again, we're not numbers, because the reason I don't say I want to get into numbers here is because this literally changes on a monthly basis. You look at it, this is a monthly basis when we do this, but they'll be made whole, they will continue their pension. I just want the council to know, they'll continue their pension, there's maybe ways to continue paying into the pension here. I just want the council to know that we've addressed that, we have a way to do it.
they will be given the option to keep their city pension,
Correct.
or they can go with the county, which is under the Florida retirement system.
Yeah, so we'll be able to keep that.
How can they do that without being employees of the city?
There's a couple different options. That's when we work with the county. I'm trying to think the easiest way to explain it. They can pay the same contribution we would pay as a contribution to the pension. The county would pay instead of us. So to them, it's the same benefit per se for the employee.
Okay, so the
It's just
county
they
would
would
County
pay
be paying their portion.
into
Yeah,
the
into the
city
city,
pension
right.
instead of
Instead of us paying into it, instead of them being in the Florida.
retirement.
And that's going to come up later when we get further in discussion to the council to make the decision on which way. The only item that I know any might have spoken, and when it comes back to council, is whatever we do, they all are going to do it. And that's why I think we're going to have to involve the union, but they're all going to do the same thing. We don't want to pick in this way or what, that's up to you guys.
No, I would think they would have that choice. That was our discussion. That was our discussion, that the employee would have the choice. Well, some of them may have, 15 years in the city pension plan, they want to continue. Others may say, hey, I want to start brand new, but they don't all have to do the same thing, I didn't think. Now, maybe I'm wrong.
Well, if they're not vested, you're saying those that are vested, or that aren't vested would do the same thing, or have the same option?
No, I'm saying
Okay.
those that are vested,
Okay.
they have the option, don't they?
All right, and we'll get back with Scott Christensen and give that answer, because our understanding was it would all be the same.
Says here, those vested can keep pension at city and begin with new FRS or continue paying into the city pension.
Yeah, that was.
Correct, that's up to you guys, but it's, and I'll have to give it Scott Christensen because it's the way the pension operates. I just need to make sure we're doing it the right way. I don't want to
I
misspeak.
think they should have their own, always, yeah, this,
Yeah, if they can, I agree 100%, if they can, they should have that choice.
Okay.
I don't know, but that was the way that he had discussed it, or I say we, the team. Yes, Councilmember Gerald.
I think it'd be to their benefit, because they can have 2 retirements if they picked it up at the county. Right?
Well,
After they become vested over there.
Yeah.
the problem is if you have, for instance, an example would be, let's say you have a 15-year employee that's gonna retire, most firemen retire with 20 to 22 years, is that correct, Chief? When they retire 20, 22 years, to be fully vested in the county, in the state retirement system, it's 10 years. So they'd have to work 25 years instead of 22 years or 20 years to retire. So that's the reason that if you have more years in, you don't have the opportunity for 10 years to get fully vested in the 2 retirement system.
But they could.
I don't know,
But I think we should give them, I would hope we could give them that choice. Okay.
I can't answer it.
And then the union items, and we discussed this the other night, the seniority, like, your years in service, sick, vacation, balances, I think y'all kind of maybe work that out. But the other was the rank and the probationary period, would they go into the county, would they be on, as a new employee and be empowered? So that's going to take the union. We have no control over that.
Well, the only thing I asked though is the council please give me a stance, or can we do a stance if it's a union item? Mr. Attorney, sorry, or just what?
I don't think it would be a good idea to get into that right now.
Okay. I did have that in the end, if I looked, if I kept on coming down, I've seen that. Does anybody see, or from our discussion the other night, before we get into the last item that the attorney will discuss with us, does anybody have anything else that they see that we either need to discuss, or something we missed, or any other items? I'd like to thank, the county, I'd like to thank Mr. Burrows and, the county staff and our city staff. I thought we had a great discussion, and I hope you agree that we came out with maybe some good compromises. Anyway, okay, we have other comments?
Mr. Mayor?
Yeah.
I brought it up before. It says in union, I think the salary should be a part of it. I think our guys need to go in with the salaries they're making here. And if they're gonna be paramedics, I don't know at what point the county pays for paramedic pay. But when we talk about it tonight, even on EMS, if we hire 2 new EMS, they're gonna be paramedics and they're gonna get paid more than some of our guys that are already here that went to paramedic school. So I don't understand why we would not be paying them the paramedic pay.
I mean, the county.
Right, they would be, if they're hiring our guys as paramedics, then I think they should be hired as paramedics. And I think they should be hired, and I think what happened, I didn't notice because it's not in this detail, but I asked the administrator, he said that the proposal was at level 3. Okay, level 3. Well, I had asked India for
the pay scale of our firefighters, and there's 5 firefighters to be below level 3.
I think our subsequent meeting, there was only one
Well,
that didn't fall under the 3, from my understanding. But that's just, again, it's just the idea of, for me anyway, to get direction, as long as you're saying pay would be the pay they get now, plus whatever they would be entitled, whatever the paramedic would get for their stipend additional.
right,
This is the request.
absolutely.
That's all I need.
Everybody understand the discussion? The discussion is, they should go with whatever their current pay is now, plus whatever the county additional supplement for paramedic. Our goal was to make our employees whole, to make sure they make what they make. That's what we went into that discussion, to make sure that nobody, because the original county proposal was they would go in and step one, and they would just be like a new hire.
Right.
So our goal was to make sure that our employees did not lose any income. And that's what our goal was. I just tell you, that's what our goal was. That was achieved. That part was achieved. Yeah, but we will have to discuss this. I think if I understood, and the reason that worked was because the county has in their union contract, as I understood the discussion, that they could hire an employee up to step 3. To go above step 3, it's going to probably take a union amendment or agreement with the union. So,
Well, originally they said they were going to have to open the bargaining agreement, and Tori told us that was not the case. That it would be an amendment.
yeah.
And it would be voted on. It would be voted on.
These would be voted on by the union. These would be voted on by the union. If you're correct, to take a amendment. Yes. The union will have to agree to that. So, Mr. Administrator, I guess we have work to do there to see if that's a possibility or maybe something the county has to negotiate with their
Yes.
Well, that's going to play into their steps also, if I'm not mistaken. Because they would be all in step 3. So it would affect the pay increases too. So you'd have someone, I don't know how many steps they have in the county, but if you have someone with 13 years experience, they would be going in at a step 3. The 13-year employee at the county might be at a step 6 or 7 or wherever it is.
And that's where the seniority.
So it has to go hand in hand. You can't hire them at step 3 and then ask them to.
Well, I think our pay scale is higher than theirs. So, but if it's fair, get us that information. Make sure we all get that.
Well, we're not looking at numbers, so we don't know for sure. Right?
Okay.
And are we going to get those numbers?
We will, but we gotta wait to see what the county. There's no sense us doing numbers. The county has this on their agenda for their next meeting,
Okay.
which is Thursday.
Okay.
And, they may come back and say, well, gosh, we don't agree with anything the city council said.
Okay.
Okay, any other discussion from Bill Lett, the attorney? We have one other item that came up in our team, negotiating team, basically came from the county attorney was the one that started this discussion. And Mr. Attorney, I'll let you take it from there. That was the idea of the dual referendum.
Yes, sir. So there has been some questions about if and when all these terms are ironed out, what needs to be done to effectuate the transfer of fire service from the city to the county. And I've also been in contact with the county attorney on several occasions to discuss the law. There's constitutional and statutory issues. The bottom line is we both believe that there is some discretion in terms of either effectuating the transfer of fire service through a referendum, in this case a dual referendum, or effectuated through an interlocal agreement. If the area of the law defining this that I can point to at least almost, probably around a half a dozen, 5 or 6 instances where fire services were transferred from a city to the county via an intergovernmental agreement. If you were to ask me to take a bulletproof belt and suspenders approach, and again, this is strictly from a legal standpoint, not from a public perception or political standpoint. It's strictly legal. The belt and suspenders approach would be a dual referendum. If the direction from you to me was to try to effectuate this through another means, I think it can be done. I've sent you all a brief memo outlining of that, but we can have for the mayor's direction.
Yeah, if you saw the memo, the Constitution kind of, it's almost like the Constitution says one thing, the state statute says another. That was the county attorney when we had the discussion. The discussion was, I guess it's a matter of risk. Is that a good term?
I think that's
a matter of risk.
Zero risk is referendum from a legal standpoint.
From a legal standpoint. If you were to do it by the interlocal, if nobody challenges it, there's no risk. I mean, there's no problem. The problem is if someone were to challenge that, then you would have, court case to go through. County attorney, and I don't know your opinion, the county attorney's opinion was he felt confident, or I guess attorneys never can get, but he felt confident he could defend the position of an interlocal. He felt confident he would prevail. Is that the legal term? He felt confident he would prevail, but it would, of course, entail that procedure. So the question that we need to answer, and I think the county will discuss at their meeting, is, do we want to do it via interlocal, or do we want to propose a dual referendum? We were told, our team was told that you have until August, and I don't remember the date in August, to propose for it to be on the November ballot. The supervisor of elections, I guess, told the county attorney that I forgot that date in August, but it was a date in August where it could be put on the ballot. So we'll go by consensus. What do you want to do? You want to take the risk and do it local? Or
Yes.
Yeah, or we'll take the risk, okay?
If that happened.
Well, I was just going to say the referendum may be different than what the council has talked about in the past, because I know a lot of times when we had this discussion on referendum, it was, was it a straw poll, that kind of thing. This would be a referendum, in my understanding, would be a binding referendum done by the county, with the county and city, same line item. So the county voters have to accept, if say we pass, the county would have to accept, and the city would have to accept. But it would be a binding one. It's not a straw poll. Correct. It's not the color of the building poll. It would be a true binding referendum. Just wanted to make sure council was aware of that.
Okay. But we just need to make that decision so we know, so the county knows which way we're leaning. I assume we're leaning towards interlocal. I don't see anybody jumping up there. We're leaning towards interlocal. So. No, I didn't get any. Everybody was saying, everybody was shaking their head. Nobody was jumping up and saying, I think we need to do a referendum. So, okay, so that was one of the questions that the county had for us. So, and then it'll be there for say.
Well, honestly, I don't see how would you word the referendum if you can't give people facts? And we don't even have those factual information yet. So how would you write a referendum bill on a ballot? Just saying, do you agree to transfer the power of firefighting and service to the county? Would it be that general?
Yeah, so writing the referendum, I think would be very straightforward. I think that you might be referring to the public education process leading up to that. Which for all referendums, there's typically a big investment of time and effort.
Okay. The consensus of the council is not to do a referendum. So we can, the county will be aware of that when they discuss. Okay, I know we have some, I know we have people in the public that would like to comment on this issue. So the chair will open up for public comments. Anybody in the audience would like to make a comment? Yes, sir. If you please come to the podium and make a comment, and if you could please give your name for the record when you get to the podium.
Comment isn't about that topic.
Comment is not in order if it's not about that topic. There's if you would like to make a comment to the council at the beginning of the meeting, we have a comment card that you file with the city clerk. Wave your hand, city clerk, and we allow public comments at the very beginning of the meeting on any topic you like.
Understood.
Thank you for understanding. Thank you very much. Any other comment? No other comments? Council, okay. Sir, if you please state your name for the record, please.
Tonight would be Noel Tanner.
Tonight.
Hanover 7 Southwest 6th Avenue. I've heard a whole lot since the workshop and tonight, especially tonight. I've got a few articles that I want to talk about. And there were folks brought up at the meeting. I did a little homework and back in 1986, I think I became councilman. We went through this one time before. And basically the city would want to just pay the county. They have 44 articles every year. The county comes with 44 articles. When the county got through reading 2 articles, they said, Ms. Harvey said, just throw this in the press, but we won't. He said, we'll lose money. And I personally think over time, the county will also lose money. As far as the redundancy, it started with OSHA many years ago. About 2 in and 2 out. And we didn't have employees for the city or the county to do what those wanted to do. So we had an agreement to go, if we had a structure fire of any kind, city and county would go to either where it be in the city or the county. So we all, so that's not redundancy, that's OSHA. And in the city, when the EMS had a wreck or something, ambulance, sometimes the city went with that also, and sometimes the county did. I think that's where some of the redundancy is showing up. It's not that we're doing it, we've done it twice, it just happened to work that way. And the county taxes, I haven't found yet, but I'm going to get before I deceased. I'm going to find out when the county imposed millage on the city. Being the city first, not the county. I gotta look at it. It's 8 mils. We're at 7.601. So we're paying almost 16 mils. There would be $344,000 for EMS in our park. Unless we just go. And it's suggested that we take the county's assessment, which is $725,000, and use that. So that's a total of $1,069,000 right off the bat. But would it be fair for the county to do this? I mean, that's what it's suggested. We just take the county $725,000 for the first year, $344,000 for EMS to pay it in income. That's not fair for the taxpayers. Now, franchise fees and taxes, it was brought up that that's why business will come in the city because of that. I don't agree with that because we have great taxes. We have 8 bills taxed on, so that's why I want to come and count the city because they have 8 bills. That's that, but I'm glad that this company wants to extend their business in the city. So that negates that. They want to do that, and I'm glad they do. And I understand that some of our permitting and build homes are going up. I know there are, but two of them built next to me. I know they're going up, that's what that is. And we all have it on commercial and industrial property in the city. We don't have a whole lot, we have some, not much. We do need our EMS. We have firefighters trained, 6 of them. If we do what this park suggested we do, we will have trained firefighters already, paramedics. And we talked about this years ago, the same thing. Back then, we couldn't, the demographics are different now than what we did. We didn't have the paramedic training, we didn't have equipment, we didn't have the resources to draw from. But today, that's clear. We can draw that resource. And a lady came up talking about paying tax to city and county. She's upset about it, I understand. She said she had a lady called Tallahassee, and they told her because you use county roads. So you can leave anywhere in the city and go in any county, anywhere in the county, out of town, you will be on either federal or state highway, not county. And my understanding is the gas station share the county roads. Should be the county, the city, part of it. I'm sure it goes to general fund. And one more thing. What about that train station? Are we going to not have train service? They're going to put Amtrak going to put coming?
It's got service.
I don't know a whole lot about it. I know I don't want to drive the train. Take too long before it goes. But anyhow, I'd like to see keep what we got. Go EMS because you can't make money there. But we talked about it too many times before, but now you really can. So I appreciate it.
Thank you, Ken. Any other comments? Any comments from Zoom?
No, sir.
No comments from Zoom? Okay, any other discussion from the council? If not, we'll move on with our agenda. Okay, we'll move on with our agenda. We'll go to the council member of Gary River council member comments. Council member Abby. Council member Gerald.
Well, I'm glad that Wes finally decided to join the mayor.
Yeah, congratulations.
And all
our condolences.
Also, our attorney has been appointed to a committee, a chair. What's the committee? I already forgot.
It's Palm Beach County Food Bank.
Congratulations.
Yeah. Thank you. Councilmember Key. Councilmember Clark.
I'm good.
No other comments? Okay. So that was the final item on the agenda.